Okay, thanks everybody for coming to this talk, and thanks for having me here. So today I'm going to talk about the value of big data in pandemics. So we know that pandemics like COVID-19 present us an impossible choice between saving lives and saving livelihood. So on one hand, population movement restrictions such as lockdowns and social distancing are deemed necessary to contain the rapid spread of the virus. But on the other hand, such restrictions often inflict steep economic cost. So for example, in US, the GDP is forecasted to decline at a 37% annual rate from April to June, which is a huge cost. So how do we solve this pandemic dilemma between choosing saving lives versus saving livelihood? A lot of countries have started experimenting big data technology, such as contact tracing apps. So in this table, I'm listing the top 10 most downloaded contact tracing apps on Google Play Store. And you can see that countries from Asia, from Europe, and from Latin America has started experimenting these contact tracing apps. However, this big data technology has caused a lot of controversy. On one hand, the advocates argue that if we are able to use the contact tracing apps to detect potential carriers of the virus, then the mass population can resume our work so that the economic impact of pandemic is going to be minimized. So they often cite the successful experience in China and South Korea, where the contact tracing apps was used very aggressively, and the pandemic seems to be contained there. On the other hand, the critics argue that this evidence is actually inconclusive, because if you look at Singapore, where they also used the contact tracing app pretty early, but you still haven't seen the containment of the COVID-19. And on top of that, big data technology always raises the issue of privacy infringement and government surveillance. And they argue that if you combine this evidence, it is unclear that big data technology is going to help. And in fact, if we use big data technology to address public health crisis like we are in now, we probably can do more harm than good. So in this paper, I'm trying to shed some light on this debate by exploiting the staggered adoption of contact tracing apps in 322 Chinese cities. So by focusing on one particular country and using cross-city variations, I'm able to control a lot of factors that varies across countries, such as culture, past experience with SARS, as well as the testing capacities, which are the confounding factors which cloud our understanding of the effect of big data technology. And second, I'm going to use high-frequency measures of economic activities, such as within city population movements and emission of greenhouse gas, to essentially pinpoint the effect of big data technology. And compared to traditional measures of economic activities, such as GDP, which only vary, only get updated every month or every quarter. So these high frequency measures, I can get daily updates for each of these 300 cities, so which allows me to exactly identify the effect of big data technology. So let me give you an overview of what I find before I delve into the specific methodology and data. So I find that cities that adopt these contact tracing apps experience a significant increase in economic activities without suffering from high infection rates. So if you do a look at the economic value created by this big data technology, I find that these contact tracing apps created economic value of 0.5% to 0.75% of the GDP during the COVID-19 outbreak in China. And lastly, if you compare the economic benefits with the cost of privacy estimated in the literature, we find that the economic benefit seems to outweigh the cost of privacy. So if I use a graph to summarize my result, you can think about this pandemic possibility frontier. So essentially, pandemics like COVID-19 present us a hard choice between choosing economic activities and public health. So if we want the economy to run in the full capacity, then we're gonna, the public health is gonna suffer. A lot of people are gonna be infected and die. But if we shut down the economy, yes, the public health is gonna benefit, but at least in the short term, there's gonna be a acute economic pain. So what I find is that the big data technology can shift this pandemic possibility frontier. Therefore, we can face a better trade-off between economic activities and public health. So let me give you a little bit institutional background. So here's an example of the contact tracing apps, which is called Health Code. So this is the very first contact tracing apps implemented in China. Actually, it's in Hangzhou. It's called Hangzhou Health Code. So essentially what does this technology do is that it uses the smartphone location to predict your risk of contacting the COVID-19 virus. So specifically, if, for example, if you happen to be in the same bus with someone who's later diagnosed with COVID-19, then your health code is gonna show you a yellow or red code, meaning that you have a high likelihood of getting infected with the virus. Otherwise, you're gonna have a green code. So this health code functions as a travel permit within a city. So if you have a green code, then you can go to any public space, like the subway, like the buses, go to supermarkets, no problem. You face no restrictions. But if you have yellow code or red code, you have to be isolated or quarantined for a number of days before this code becomes green. So let me talk about a little bit this kind of history of this health code. So this health code, as I mentioned, it was first implemented in Hangzhou, which is the headquarters of Alibaba, who happened to be the company first developed this health code. And the time is February 11th, 2020, and which is 17 days after the Wuhan lockdown, which is very, very fast. And then this health code was expanded to other cities in Zhejiang province, where Hangzhou is located. And the adoption rate is quite high. 90% of the population, the provincial population, adopt this health code. And among all the household code, 98.2% are green, meaning that 1.8% are predicted to have medium or high risk of infecting with the virus. And notice that the adoption of, to register the health code is entirely voluntary, right? So the government is not asking the citizens to register, but in some sense, you have a high incentive to register it because only if you get the health code, you can go to the public space, like the supermarkets, like subway. And later on, after the introduction of health code in Hangzhou, other cities start to learn from them and implemented this health code system in a staggered manner. And notice that the implementation is uncoordinated by the central government. And actually, different cities often have different versions of health code. We have initially the health code developed by Ant Financial, which is a affiliate of Alibaba, and then Tencent, which is they produce this social network called WeChat, which is a Chinese equivalent of WhatsApp, and Facebook also have their own version. And other Chinese cities have partnered with other tech companies coming up with their own version. And there are so many versions of health code to the extent that the central government actually warned the local governments not to do too many versions of health code because it creates a lot of confusions and inconveniency because sometimes people are asked to show multiple versions of the health code in the same location, and occasionally different versions of the health code show a different result. But this uncoordinated implementation of the health code is a really good setting for researchers to identify the effect of the health code, because we can look at cities which adopt this system early versus cities which adopt them late. So now let me go through the data. So I first collect the implementation data of health code for 322 cities in China. In this graph, I showed the numbers of cities that adopt the health code on each date, which is a blue line here. you can see that the Hangzhou health code came 17 days after the Wuhan lockdown, which is very, very fast. And the red line here shows the cumulative numbers of cities which implement this system. So this graph shows the geographical distribution of the health code implementation. So the green and yellow cities are those early adopters, and the orange and red cities are the late adopters. And you can see that there's no particular pattern that, only cities around the Wuhan or Hubei area adopting it. It's quite balanced over China, and there's no coastal versus inland bias either. So second, let me move to the second data source, which is within city population movement. So this data is to use to measure the high frequency measure of economic activities. This is constructed using the smartphone locations from Baidu, which is a search engine in China, similar to Google. So here I normalize the starting level to 100%. And you can think about at the beginning of the year, the economy is running at 100% of the capacity. And then after Wuhan lockdown, you can see that economic activities quickly drops to the 40% of the normal level. And then after the introduction of the health code in Hangzhou, the economic activities start to recover gradually. So here is the average for the national, for all of the 300 cities in the country. So you may worry that, the within city population movement is not, may not be able to measure activities that can be done without people moving around. So as an alternative measure of economic activities, I use the greenhouse gas level of each city. So in particular, I use nitrogen dioxide level of Chinese cities. So why nitrogen dioxide? This is because China is heavily relying on carbon as a primary source of energy. If you burn a coal, you're gonna emit nitrogen dioxide. So again, I'm normalizing the initial level as 100%. After the Wuhan lockdown, you can see that the emission of NO2 dropped to 40%, and after Hangzhou health code, it slowly recovers. So you can even see this recovery of the NO2 level from satellite image. So here is the graph from Google Earth. So here I'm comparing 2019 and 2020 levels. You can see that in 2019 through January, February, and March, we do not see any variation in the NO2 level. Whereas if you look at 2020, the January, still we see a lot of emission of NO2. In February, when the whole economy is in standstill, we see a very little emission of NO2, and the economy rolled back in March, which is quite substantial given that China is the first country get hit by the virus, and so the economy is able to recover within a month. So lastly, I'm also using the daily COVID-19 infection counts for the cities. Here, the blue line here is the number of confirmed cases. Here, I just want to highlight that when the first health code was introduced, China is still in the exponential growth path. So it is not, the outbreak is over and China has this health code. And actually, the first health code was introduced in the mid of the in the peak of the outbreak. So let me go over the results. So the research design I'm using is the typical difference in differences methodology in economics and finance. Essentially, what I'm doing is I'm comparing cities which introduce health code with a city which does not introduce a health code before and after the introduction. So you can see that the introduction of the health code leads to around 2 to 3% increase in the within city movement, and the result is robust if you drop Hubei, whereas which is the epicenter of the coronavirus outbreak, and it's also robust if you match the cities by the number of cases, or if you match the city by the level of economic activities. So this is the kind of the graphical representation of the regression. Essentially, in the vertical axis, I'm showing the difference in the economic activities between the treated cities and control cities. And in the horizontal axis, I'm showing the time since treatment. So you can see that before the treated city implement health code, the treated city and the control city looks exactly the same in terms of economic activities. So there's no significant difference in terms of economic activities. There's no pre-trend. However, after the introduction of the health code, you can see that the treated city witnessed a significant increase in the economic activities by around 2 to 3%. So now we can also use the CO2 level as a alternative measure of economic activities. And again, you can see that the introduction of health code is associated with 2% increase in the NO2 level. You can also look at PM 2.5, which is the fine particles as a result of chemical reactions between the greenhouse gases and the dust. And you can see that the introduction of health code again leads to an increase in economic activities as measured by PM 2.5. So we can also look at essentially the population inflows to the city. So what I find is that the introduction of the health code increases the population inflow to a city by around 13%. And also the introduction of health code decreases the population outflow from the city by 15%. So which means that if you have a health code, it seems that your city becomes more desirable to live. There are 10%, 12% of people want to move in, and there are 15% of people don't want to move out. So you may ask now, given that if we, even if we see an increase in economic activities, what if the infection rates spiked for those cities? Then we do not really change the trade-off. So to answer this question, I'm looking at the infection rates of the cities which implement health code and compare them with the control cities. And I find that the introduction of health code does not lead to a significant increase in the infection rates. And again, you can see that in this regression in a graphical form, where the introduction of the health code at date 0 does not lead to an increase in the infection rate, despite that the economic activities has increased substantially. So lastly, we can estimate the sensitivity of infection rates to economic activities in cities with health code and without health code. So that is essentially identifying this pandemic possibility curve. Again, this just shows a trade-off between economic activities.
1 minute mark.
Yeah, thanks. The economic activities and public health. And you can see that the introduction of the health code shifts these pandemic possibility curves to the right, meaning that we have much better economic activities without jeopardizing the public health. So let me just mention one last point. Does the benefits created by health code justify its cost? And using my estimate, I quantify that the economic value per person in China is around $50 to $70 per person. And if you compare it to the value of privacy for Chinese people estimated in the prior literature, that's around $33. So it seems that the economic value outweighs the value of privacy. So last point, I just want to mention, why is big data technology so effective in fighting pandemics? And the reason is that the key amplification mechanism of pandemics is incomplete information. And because viruses are hidden and people are afraid of going out, which brings the economic activity to a standstill. And because the carriers of the virus are hidden, the governments have to impose quarantines on the whole population just to stop a few hidden carriers. And now if big data technology can effectively identify those who carry the virus, then the economic cost of pandemics can be greatly eliminated. So just to conclude in this paper, I find that the cities which adopt the contact tracing apps experience a significant increase in economic activities without suffering from high infection rates. And the economic benefits seems to outweigh the cost of privacy. Okay. Thank you so much for your attention.
Thank you very much for this talk. I see Margaret has a question.
Please.
Hi, thank you so much for your talk. Very interesting talk on China. Have you given any thought to this, however, as it relates to very, very different socio-political contexts? I mean, certainly in the American context, terms like surveillance are simply dirty words. This is a society where the New Hampshire license plate reads "live free or die," and Americans simply don't have a stomach for that kind of surveillance. I mean, you have to stop and consider that even in the wake of 9/11, there was a tremendous reaction against something like wiretapping. You also have to stop and consider that this is a highly diverse society. And so, you know, there would be fears that this surveillance becomes another version of stop and frisk on the street for African Americans. Or you have to consider something like Michigan militias, who just recently, as last week, showed up on the Michigan State House stairs, you know, armed. So this is a very, very different society. I mean, we still have highway patrols because people have reacted against having cameras, you know, take pictures of them driving their cars and sending out speeding tickets. So, you know, in a democratic society, where the very idea of surveillance is seen as anathema to liberty, especially government surveillance, I mean, have you given any thought to how this works in this society? Because I just don't see Americans, you know, giving up their privacy.
Yeah, thanks, Margaret. So this is a great question. So I think there, you know, in the paper, I also discussed, you know, the kind of how do we kind of extend this result to other cultures and other countries. And I do recognize that there's huge cultural differences in the value of privacy. And so here I want to make 2 points. Firstly, I think using this contact tracing app is not equivalent to giving up privacy, given that we have a lot of technology to anonymize data. And in fact, this technology is not actually run by the central government, as you know, the media pictured. It's actually developed by the tech company, and you know, it's with the partnership of the local governments. But you know, the whole idea of registering for the health code is entirely voluntary, right? So we're in a lockdown, and you know, if you don't have health code, that's fine. You can just stay at home. But if you have a health code, essentially obtain a permit to go to supermarket. So on that hand, I don't think, you know, that, you know, even in China, that is kind of a central government's initiative to impose surveillance. That's not the case. This is essentially, you know, the initiative of the tech companies and the local governments. And we do see such initiatives in US as well. So for example, I read a Wall Street Journal article last week about South Dakota and North Dakota. And in fact, they have their own versions of contact tracing apps. And, you know, people are pretty happy with it because, you know, if you are facing losing job or, you know, not being able to go out of your apartment versus, you know, being able to certify that you are healthy, you have a low risk of contacting the virus, I think that trade-off is pretty clear. And the other point I want to make is that despite that, there's this cultural differences in the value of privacy. So there's this paper in economics where Susan Acey and her co-authors run an experiment in the US, and they document this privacy paradox in the sense that even if a lot of Americans claim that they value privacy, but if you give them a little bit of benefit, they are actually willing to give up you know, their privacy. So in a sense, I think in a democratic society, people should have the choice to choose whether they want to have a system like this, right? So I think what I'm trying to do here is to present the benefit side of this technology, given that we are losing so many lives and a lot of people losing their jobs. You know, there's a huge economic value and public health value can be gained if we have companies or even partner with the government or without the government provide such technology, then, you know, people can make the choice. You know, that's kind of the
May I have a follow-up question?
Okay. Mark, there are other questions first. So for the sake of time, I think we'll stop here. Neville Klein.
Yes. Hi. Given that you showed some changes in inflow and outflow of the population, I was just wondering how you controlled for that in your outcome analysis.
I mean, the outcome here I'm using is the within city movement. So essentially how does that outcome is constructed is that if you have your cell phone, if you move between the signal towers within a city, then the Baidu, which is the search engine, going to record that there is 1% movement in the city, and they just accumulate within the day. And I think that's part of the economic activities, right? If there are more people moving to the city, and less people move out because the city becomes more lively because people can go around and go to restaurants. Then I think the inflows and outflows to the city is part of the economic activities which we want to measure.
Yes, thank you.
Thank you.
Maria Paola Sutto.
Thank you for the presentation. I wanted to know where you retrieved the data from the infectious rate that you presented.
So yeah, so this data is from Chinese CDC, and the infections.
Sorry, Kairong, could you stop sharing so that the next speaker can load their presentation?
Okay, yeah, let me do that. So the infection rates is, so firstly I obtained the daily counts of the COVID-19 cases. And then the infection rates is just the new cases divided by the existing active case in that city.
I see, thank you. And so you don't have more granular data, because my real question was, when you talk about livelihood, I think that this application could give a fake sense of security because people are all in different range of possibility of infection. And people who have pre-existing condition like a diabetic, it could have the fake idea that he goes there and just, it doesn't get infected. So we need to have a better articulation, which people got infected, which died, used in the application. Otherwise, I don't think could be applied.
Yeah, great. So I think that the data is not breakdown by demographics or the pre-existing conditions, but it is indeed breakdown across cities. So in a sense that what I'm showing here is on average, a city across the population in the city, we see no increase in the infection rates after they introduced the health code, despite the economic activity has picked up.